Finding the Voices talk show by Monica Ibudam.
I'm a huge fan of Finding the Voices.
You're doing a great job for Manipur.
Manipur bu prithivida masatak pa
good positive voices and make those voices more visible.
We wanted our voice to reach in all the corners of the world.
Interesting people.
Finding voices on
people from our own place.
Share positive stories and inspiring stories and bring out the good stories of Manipur.
Finding the Voices.
We would look forward to developing a center here which take care of training people in palliative care in the not only the northeast and the eastern region, but also people from Myanmar country. In fact, we did have 2 surgeons who came here from Myanmar for training in surgery, and Dr. Suresh was here during that time for training us for palliative care. They joined us and they were trained in palliative care from Myanmar. So that is a situation we are looking forward to. But as of now, since we don't have any funds, we are not able to provide medicines to the patients free of cost. That is not possible as yet.
Right.
But in Kerala, they have a system to divide the patients into 4 groups: very poor, moderate income group, and rich people, high income group. So for very poor, they give everything.
They give it free.
They give it free, and sometimes, if necessary, even food packets. For poor, they give services and medicines free. For medium income group, they give the care free, and sometimes they prescribe the medicines if required. But as far as possible, they try to give the medicines free to them also. But the high income group, they only give the care free. The medicines and all other consumable items have to be bought by the patient. So that's how they have grouped, and they are giving the services over there. Here we are not able to. The intention is that once we start that, it should be continuous. So we have to reach a situation where once we start giving some free medicines to the patient, we should be able to do that continuously till the patient dies. So once in a while contribution will not be able to do that. You have to have a sound backing of that.
So right now, it's only the resources, as in the time and the expertise of the person,
as well as the personal contributions from our own members and the voluntary contributions. Some doctor has pledged to contribute 1,000 from his salary. Some college lecturer has pledged to contribute 300 rupees every month from their salary. Like that. That is what is that. Now this has to increase. We cannot wait and depend on the government to develop systems all the time. This has to be taken care of by the community.
Right.
And it's
but
not
also,
only a matter of cost.
I do have hope for the government, because sometimes when such initiatives are taken, then maybe the policy will come into effect to expand it.
Yes, fortunately, we have we are very fortunate to be able to bring this awareness to our Chief Minister and the Deputy Chief Minister. They were both there for our program of. We had held a international conference here in November 19 and 20 of 2015. About palliative care, and faculty from across the world came and taught us about palliative care. So at that time we were able to, with all the other faculties and Dr. Suresh Kumar, we were able to impress the Chief Minister the necessity for this, and he has been very accepting. In fact, after that we have communicated, and Dr. Suresh Kumar has sent the Kerala model of healthcare policy in palliative care. And we have worked it out suiting our Manipur this thing, and we have to submit it to the government now. Since the assembly is going on, we are waiting for that. After that, we will be submitting it, and then we'll see how it goes. There should be a state policy on this matter.
Right, because I think particularly because our state is so conflicted with young minds not knowing and confused, I think the volunteering concept would help a lot.
Yes, exactly.
But like you said, nobody is going to just come and opt for volunteering, but if there is a policy of school children and college children to
Correct.
have, this many hours
Yes.
for servicing or services, then it would, I think, really help.
Yeah, it will come in a big way.
Right,
we can,
right.
get them involved.
Yeah, because
in a big
I mean, I have seen the system in other places where the school children and everybody, like, they have certain hours where they have to complete.
Yes.
And I think that helps
Very
the
true.
institute as well as the person.
Correct.
And
Very
in
true.
our place where everything is so volatile, I think the
Yes.
personality of the youth would change, and I think that would help.
Yes, very true. And especially in palliative care, I would like to mention here that it is mainly about communication. Most of it is, in fact, more than 70% of palliative care is communication, sharing, sharing really deep, and experiencing those feelings. And that is about the cost of the expenses is more in terms of time and availability rather than the money itself. So as they have worked out in Kerala with their population and the number of patients that they have worked out that a volunteer, if all the people shell out 2 hours of their time in a month, it is adequate to give extremely good palliative care to the entire community.
Yeah, that's
so
just
it's
2
it's
hours.
about 2 hours a month.
Right.
For them, they have calculated like that. I don't know how much it will be for our population, but if you take it to the ratio of the population, it should come out to be the same. It should not be much different. So 2 hours a month is not too much to pay.
Right. It's
only
less
if
than
everybody is involved.
Right. It's
If
less than
everybody-
watching a movie.
Exactly.
Right.
Exactly.
So yeah, I would definitely encourage all my young listeners to sign up for volunteering and try it out. I'll be sharing out the Facebook page where you can sign up.
Yeah. So the student volunteers, they can be given a locality or around their own house and identify few patients there, which can be registered by the parent body and then handed over to them. They have to go and visit them once in 1 month, sit with them with one patient for half an hour and just talk, nothing else.
Right.
That's about it. And the amount of benefit the student gets is tremendous.
Yeah, that's true.
The teachings of the elderly and the feeling of goodness once they come out of that room or house. The feeling of goodness that is it can be compared.
Yeah, money cannot buy that.
Money
feeling.
cannot buy that.
Yes.
That
Yeah,
feeling.
I had once volunteered for a care for a patient who has dementia, and my job was I have to just go and have breakfast with her.
Yeah, so
And
that's really
and
wonderful.
see, I just have to make sure that she takes her medicine.
Yes.
I was told that I should not be touching the medicine, but she has to take that medicine. So it was a very wonderful experience because I was away from home and I was missing my parents, and it was a way for me to connect to the older generation, and I think it was really good. And after that I felt I should volunteer more, and I started thinking why we don't have it much in Manipur. So I'm really happy to see that we have such initiative coming wherein
I think this is one area where it really brings people one-to-one and human-to-human connections. And
but I am very positive. Our young people are also very keen to try out, because I've seen other initiatives like, say, Blooming Manipur, where they have started planting flowers, you know, by volunteering themselves.
Yes, yes.
So
I'm also very
good.
positive. In fact,
Right.
I'm getting responses which I did not expect, and it has been really quick. In fact, we had those faculties from Thailand and Bangladesh and others who had come here for this conference, and they were really surprised, because we had started working only in the 2015 April, May onwards. We have started working really into palliative care. 2014 we got initiated and got trained, and we were learning about it. Then 2015 we started, and by November we were able to do an international conference, with already having gone into home care visits and continuing to do it on a regular basis and all this. And they were really surprised that the initiative has gone really quick. And that was possible because of the people who are involved and who are really interested. Right. And those doctors, the nurses, and the students who are involved are really they're passionate, and
because you have to have that belief in you, in that cause.
Yes.
And I think that's only. It's only when you have the belief that it would work.
Yes. So in a movement forward to get trainers, we have sent 2 nurses for a 6 weeks course in Kerala, in that same institute. They have trained for 6 weeks and then come back here now. And they're all charged up, and they want to really blast off with all their knowledge and share their experience and train many more people. So they have become trainers. Similarly, we have sent 3 students there to spend 2 weeks over there and experience their work, how the volunteers are working over there, and they have come back again charged like that, and they have involved with me to go spread this awareness. Even today we had an awareness program in Tampa Hotel. So there were ladies who were Anganwadi workers and others. There were 40 of them, and a student volunteer went along and he was speaking to them about what is volunteerism, and I felt really great, because it is a real transformation for him. So that is how it is going. I hope that this will catch on real fast. We have had these sessions with the press club as well, and then the Rotary, and then so many institutes, the ICM, the university we have had.
But
now it has to really.
I think it would help if the people who are involved, or who are, I don't know if they'll be open to speaking, the family of the patient, if they speak out of their experience, and if we share that, I think that would help in more awareness.
Yes. Yeah. Patient relatives, yes.
Patient, relative, volunteers, you know, the whole, like whoever is involved.
Correct.
Because even when I would volunteer, when I check the website, I would look at their, you know, small clipping of videos of people sharing, and I would feel that, oh, I want to do this, you know. So I think that would inspire the youth to come forward and participate.
And the one thing that I would like people to know is that palliative care is not about the patient. Palliative care is not about others. Palliative care is about me and myself. Not only in terms of development of me and myself and my character and my growth, but also because I will need it someday or sometime. And we have to develop a system when my family, or somebody nearby, near me needs it. The system is available to take care of that. Otherwise, we are losing track. I don't think very many people are taking care of the patients who really require palliative care and who are lying at home. We see situations now, and when we speak of these things to the people, to groups, then they realize that these things have been there already, but they have not noticed it. And only when we tell them that these things can be done, then they realize, yes, it is true. So it is not about them, it is about us and me. So that's what something I would like to tell about palliative care. And everybody is going to die, we know that. We cannot escape it, but the life that we lead, at least towards the end, can we give some dignity as a human being? Are we going to leave them with toned skin, paraplegics with toned skin, big ulcers, bed sores, or are we going to leave them soaked in their own urine and stool? Are we going to leave them suffering with pain all the time? Can we do something about it? Can the society handle these situations and turn out of it? So that is the challenge. And I think we have a bright future.
Right.
Yeah.
It is, I mean, at least now the initiative is there.
Yes.
There are steps and plans. We just have to get together and work and make it as a big change.
I, as a surgeon, was the first day I was wondering how will I go about it. But once I realized the situation and the need for it, I thought that there's no wasting time, because it is going to be too late. So we have moved forward, and other doctors have joined, and it's a really wonderful. We have become a very nice community now.
So thank you for sharing about this initiative. Is there any other thing which you want to mention before we proceed to the closer?
Yeah, just that again, as you had reminded me, that palliative care again is been very successful in Kerala because of
people's
their
involvement.
Their
NRI, yes.
Who are not there at home, far away, but they want the care to be given to their relatives and near and dear ones. So they contribute a lot. The NRI contribute a lot because, as you said, they feel safe that at least there is a system which will take care of their relatives and parents, and in old age and their debilitation. Somebody will be there to take care of that. So palliative care again is for beneficial for people who are working out.
Right, and in today's society, you would see in almost every household their children working outside, and this has become a very common phenomenon. Not
only outside, if they are even working in the same place, like if the couple is working outside, the parents are staying at home, all of them go out, including the children. They are out of the house, and nobody is there to actually be with the parents.
Right.
In fact, this happens even with myself. My parents are there. They are all out. Right. By morning, all of us are out. So now, if there is a system,
yes, we definitely need that system.
The system is there. Even if it is not myself, there is a system. There is a group of people. There are people who will at least take care, visit them, see their health issues, take care of them. Right. It will be a big relief to everybody.
Right, right. And the feeling that, because in case of emergency, for people who are staying outside, you can't just come in, suddenly it'll take some time.
Exactly.
So it's a great solace to people who are outside. Yeah. And I think we definitely need such initiative, and we need to pitch in together to expand and make it, more big.
So
Monica, Finding the Voices.
Finding the Voices.
Finding the Voice.
I could see my father. Who came to meet my headmaster because he was unable to pay the fee. I'm sorry.
Because we need such story for people to have faith in the government and the system, that yes, it's working.
Let's bring peace in our home state, Manipur.
Who have got the job without bribery, they will do justice to their job, and they will help raise the standard of Manipur.
Me machine creado. I adu paraga tingogi.
Aire. Adivine, Paco.
I don't know how much you know about Finding the Voices, but just wanted to get your feedback and comments on Finding the Voices.
I'm an ardent follower. I've followed so many of your productions, and I've seen it's really wonderful. I mean, today is a science time of IT, and that there are people who are knowledgeable in this sector, and then utilizing it to portray and to propagate goodness in our society in Manipur, not only to people in Manipur, to everybody else in the world. It's really wonderful, and I really appreciate the work you are doing, and it is really laudable. It's really good, and so many of the interviews inspired me. I don't remember, but there was one particular boy who was training for in the hotel
management. He was in UK, yes.
UK.
Very young and vibrant.
Young. I mean, just to watch him speak and then your interview with him, it really charges everybody.
Right.
So
I was sitting in Washington DC, and he was in
exactly.
UK.
Yeah, that interview. So it's I mean, it's amazing the work that you're doing. It's really good.
Yeah, thank you. No, I think it's more the participation of the guest speaker, like your voice, which is going to inspire our listeners. And then I believe that our voice is going to bring a change. Because right now, when I talk to particularly the young people, I see a lot of muddled mind who wants to do something good, but they don't know like what to do. So a lot of people in between, it's been a little bit of a struggle because I have a full-time job. I have 2 kids. So it's hard to balance, and sometimes you get critics, and I'm like, okay, I'm just gonna leave it. But I get very nice message from our listener who has been influenced and impacted, and I think their voices and their message keeps me going.
No, you should continue. There's no way you can
yes,
stop.
because I feel that we have a lot of good things in our society, like all this initiative, which I would like the media to cover, but since they are not covering, I feel we should promote it and make it magnified, so that people will know that, oh, okay, there are these things happening. Otherwise, everybody is talking only about the conflict and other things.
Yes, very true. And in most of my awareness talks that I give about palliative care, I ask the people about one constant which is there, other than death, and that is change. And at least we have, in our capacity, in our ability, to make the change for the better.
Right.
And the choices that we make will definitely make the changes for the better. So although we cannot avoid change, we cannot prevent change, we should at least make sure that we are moving towards the better change.
Right, and I think all of us are responsible. We cannot point that, oh, he or this organization has to do it. We have to pitch in and do what we can, and only then can the whole society change.
True, very true. It is the world changes when I change. So we have to start basically from that concept. I have to change for the better, and definitely the world around me will change. I firmly believe that and practice it, and hope that we propagate it to others and they feel the same.
Right, and yes, and Shija Hospital, I'm a great admirer of all the leaders here. I'm particularly thankful and impressed about being transparent and sharing updates, I think, which is very important. And then we also see initiative like the recent earthquake. You have provided free beds for the victims and such social cause, which again, like I said, I feel that we need to highlight all those, but most of the time we highlight other things, which is why we are here for. So thank you for all the good initiative, and I'm looking forward for this palliative initiative, which I'll be following, and
Thank you
will
very
also
much.
be involved. So thank you so much for your time today.
Thank you for giving me this opportunity to speak with you and share my thoughts and feelings about everything. It's been really wonderful. We will have another conference in palliative care in 2017. The first one was called First Palicon, 2015. So we will have a second Palicon 2017 in most probably November of 2017. So I would invite all those people who are interested. They can from now on be in touch, and then we will have a nice get together for palliative care in 2017 with much more developments by that time.
Okay, looking forward. Thank
you. Thank you so much.
Thank you.
Please tune in at Finding the Voices.